Okay, so now it's time for my medication review so we can go over what kind of medications that I take. I take medications to treat my bipolar and my post traumatic stress disorder, but I also take medications to cover up the side effects of the medications that I take to feel better emotionally. First drug is right here. It's called Geodon. It's generic. I take it twice a day. And then at nighttime, I take something called Seroquel, which is also generic. And during the day, I take something called Klonopin. And Klonopin is a drug that helps me with my anxiety. I tend to be like a really panicky type person, always kind of scared of stuff and just not feeling right. So the Klonopin really helps with that. The Seroquel is for the sleep. The Seroquel is the most sedating drug on the market, and it's the only drug actually that will put me to sleep. They've tried numerous times to get me off of Seroquel because of the side effects, um, but it's been unsuccessful. The side effects that I get from the Seroquel are one, constipation, two, impotence, and three, that I do not empty my bladder fully, and I end up wetting the bed at night and needing to take or wear a diaper at nighttime because I might pee on myself or pee on the bed because I don't wake up to pee. So the medications that I take to cover that up are one, I have something right here. This is a stool softener, so I take this, and then I also take something called Cialis. Cialis is good for the impotence, but it's also helps me retain my urine to a certain level and then to empty out fully. So I take 5 milligrams of that a day, but it's also again good for the impotence if I take it at nighttime. I will tell you another side effect that I've experienced that I don't particularly like, nor do I think that there's any medication for it to fix, is that I've, like, since I started taking the Geodon and the Klonopin, I have had a loss of libido. I am no longer horny. I just don't get horny. I just go day in, day out. I feel kind of a little bit more dead on the inside, a little less animated, a little cloudy, and I'm not having the panic attacks anymore. So it seems that no matter what they give me, it's going to have side effects, and the side effects are really unknown, and it's depending on the medication. Right now, they have me at a pretty good level where I don't have the panic attacks 2 or 3 a day like I used to have. Now I'm having one or two a week or one or two every other week at most. So these are the medications that I'm taking. These are the effects that they have on me, and this is what I'm doing to try to keep myself healthy. Beyond the medication, I also exercise on a regular basis every morning to kind of get me out of my funk that I wake up in every single day. But the sleep has been better since the Seroquel has gotten up to a much more hefty dose. I'm on 750 milligrams of Seroquel in the evening, which is probably enough to knock out a horse, at least for a couple days. So they're giving me that, and this is where I'm at. And I'm not totally unhappy where I am, but at the end of the day, I wish I could just be a normal human being and not have mental illness, but unfortunately, I have it. It's biological. I can't do anything about it, and it's the same as having any other kind of ailment that you need to take medication for.